Okay, I would, being Colorado, I just have to say that we have a superstar lineup of speakers. And the moderator today will be my dear friend, Margaret Chesney. Dr. Chesney is a professor of medicine at University of California, San Francisco. She has served as the director of the Osler Center for Integrative Medicine, and she was the first deputy director of the National Institutes of Health, National Center for Complementary and Integrative Health. She has studied the role of stress and burnout on health and developed lifestyle and other health interventions that enables individuals to prevent disease and promote their well-being. She's also a member of the National Academy of Medicine, and Dr. Chesney has been president of 3 organizations. Most recently, she's been president of the Academic Consortium for Integrative Medicine and Health that's made up of approximately 75 of our medical schools. So there is a shift going, as you'll see during this program, throughout almost every stakeholder group. Dr. Chesney?
Thank you so much, Lynn. It's very kind. And I want to welcome all of you. Oh, and she's going to switch my slides. Thank you so much. You're welcome. To this really, really important caucus. And what we're focusing on today is answering this question: what is missing from medicine? And the answer to that is really health. Health is missing. Now, what I'd like to do as I begin is to borrow from an advertisement that some of you may have seen on television, because I think it captures really what we're going to be talking about today. And that is asking you, let's see, oh, we don't have animations. That's good to know. This is an ad that's been out. It says, just imagine, I'm going to let each one of you pick out the car of your choice. So take a minute. What would you, if you could be given any car, what would you choose? And then you would say, wait a minute, what's the catch? And the catch is that this will be the only car that you're ever going to get. So if you're 16 now, this car has to last 70 years. But this, you can have that car, and I do have this car in mind for myself. And so what are you going to do? Knowing that it's the only car you're ever going to get, you're going to be thinking about, what kind of oil would you use? What about batteries? Well, I want to get an electric car, so I have to figure out all about where I'm going to get the electricity. I'm going to be thinking about who should I talk to? Who could be the best mechanics to help me with my car? What are the best tires? You would be thinking about this because it's going to be with you for the rest of your life. And I would want manuals. Give me guidebooks. I want to know all the best things that I could be doing to keep that car forever. Well, the truth is, you're not only going to get one car. So we know that. And that's, we know that about cars. But you are only going to get one body and one mind, and it has to last your entire life. And this is true for all of us. One body, one mind. And for many of us, unfortunately, childhood has adverse childhood experiences. And those experiences, as you're going to hear later, set a trajectory for a child. We can tell early on, when children are 9, 10, 11, things that are likely to affect them for the rest of their lives. Lifestyle choices that we make in midlife, even as teens, can create risk factors later for chronic illnesses. Those are just so important. And then, eventually, there are health challenges that people are confronted with, and the clinical care choices that they have, particularly for many of us, they're limited. Those choices will further limit choices, so that all of a sudden what was once a possibility of a whole health life, that of vibrancy and resilience, is lost, and it can be lost in the earliest years. And then for others, and this is what integrative health and wellness offers, childhood can set a trajectory for health and wellness from here forward. And we don't offer that yet, but it's possible we could have that. Lifestyle choices, those can create resilience so that you could be on that airplane and get exposed to a lot of viruses and not get a cold. And because of the way you live your life, the life choices that you make. And then when health challenges arise, you could have the full spectrum of clinical care options for you. And what we really want to have is where you can have access to a team of experts. And in fact, you should be the captain of that team. You should be the person saying, now that I know that I'm confronted with this choice or this problem, you know, help me get the advice together and then make your decision on how you want your health care. And this is what you can have with integrative health and wellness. And this is the kind of the definition that I think captures this. This integrative health and wellness field emphasizes healthy lifestyles and self-care. It provides information for personalized health-enhancing and disease-preventing strategies, giving people information they can really use, like a consumer's report of how to stay healthy. It focuses on, as actually Representative Kaufman used the term, the whole person, body, mind, and what gives life meaning. For example, I could sprain my ankle, and being someone from San Francisco where we have the Warriors, that doesn't matter so much. But if Steph Curry sprains his ankle, this actually throws our entire city into turmoil. So body, mind, and that what gives our lives meaning actually then characterizes what it means to have an illness, and it can be very important. Then when something occurs, when you need clinical care, integrative health and wellness offers you evidence-informed therapeutic choices, the full menu. And it offers you healthcare professionals and disciplines so that you can achieve optimal health and healing. Right now what we have is if you go into a restaurant, imagine if you're given a menu, but it doesn't have all of the pieces on the menu from which you can choose. That's what we face now. Now, you might say, wait a minute, we have the best health care in the world. How many of you have heard we have the best health care in the world? We hear that a lot. But let's look at life expectancy, and some of you know this story, that basically looking at life expectancy, how long do we live? People in the United States live to, and this was around 2000 and 2014, it used to be 76.6 years. That put us about 37th. And Japan is at 81 and a half years. So we are not doing that well. And actually 2 days ago, we were compared with the top 11 nations in terms of productivity, the top wealthiest nations in the world. We are number 11th in life expectancy, at the bottom. What did it cost before for Japan to get to that 81.5 years? About $2,000 per person in Japan. It was costing us about $4,500 a little while ago. Flash ahead to this fall, and they reanalyzed all the numbers. Japan went to 83.9. They're still number one in the world. And we're down at 78.8 years in life expectancy, just around where Cuba is. And what is it costing? They've increased their cost. It's about to $4,000. And we're close to $10,000 per person. So something is wrong here, and it's affecting all of our lives. We're not doing well. Here's some more facts. We rank number one in obesity. 70% of adults in our country are overweight or obese, 70% across the whole country. We rank 33 out of 35 on diabetes, number one in drug-related deaths. You've already heard about that. We're number one in pharmaceutical spending. And I got this figure from 2 days ago that the average person, this is the basic per capita cost of drugs in the United States, that's of all people, all the millions of people in our country, $1,443 a year for every single living person in the United States. And we rank number one in infant mortality among those top 11 nations. We can do better, especially for that price. In 2009, there was a meeting at the Institute of Medicine that's now called the National Academy of Medicine. They concluded, and you heard the representatives saying this, we have a disease-driven, not healthcare, it's disease-driven approach. Spiraling costs that you've just seen. It's fragmented. It's a fragmented system that's reactive and episodic, as you'll see later in my talk. We react when we get sick, otherwise it's sort of silence. And it's inefficient and it is very impersonal. Now I'm going to take the definition I just gave you and let's look at it against that summary from 2009. With integrative health and wellness, we get an integrated, personalized team approach that focuses on healthy lifestyles and prevention, and it reaffirms this relationship that each one of us should have with a team. And we're going to be hearing from a team of professionals because that's what we should have access to help us in designing an optimal health and well-being for ourselves and our families. Now, we're talking about integrative, and it puts all of these pieces together. We're all familiar. This is not as opposed to conventional. It's the best of conventional medicine, the best of knowing what we should be doing with our lifestyles in eating healthy foods, physical activity, pulling in complementary approaches when they're appropriate, acupuncture, yoga, and now a new something that I see sort of spanning the spectrum that you're going to hear about very soon from the Department of Defense and the Veterans Administration, which is actually doing it, and that is really whole health coaching, coaching people so that they can take from any piece of the menu that is best for them at this time, not just to overcome a problem, but to enhance health. Now, what about these complementary approaches to health and wellness? I just want to mention something because there's a lot of interest in those. They've been around for thousands of years in some cases, but how many people use them? Real quickly, this is informative. It was mentioned that I used to be at the National Center for Complementary and Integrative Health, and we did a survey in 2002 and 2007 looking at how many people used these complementary approaches. And actually, we have young kids up there because when I was there, we had no data on young people at all, and we did not know what young people were doing. Grants were coming in on probiotics for kids, and our council was saying, wait a minute, we don't know if that's safe because we don't have any science we don't even know if kids are using yogurt. And I will tell you, I was in the government, so I had to be very polite, but I thought like saying, can't we just go look at Safeway? I mean, it's sort of obvious that this is really, everybody's buying it. But so we needed data. I learned, okay, not a problem. I asked for extra money, as they only had money for about 31,000 interviews, and they said, no, we won't give you any more money. But I was acting director, so I said, I have an idea. When you get into a household and randomly sampled and you got some people under 18, ask about it. So they did, and we got data. And what we found was basically from 2002 to 2007, there was an increase. We were close to 38%, about 38.6% of every American in the country, that 38.6% had used integrative medicine in the last year, the last 12 months. And then by 5 years later, it was about 38%, and then 12% were using children were using something, echinacea, fish oil, they were using it too. So we had the data, and then we could fund the studies on probiotics for children. And what we found in the 2012 survey was similar. Almost half of the people in the country using their own resources are reaching out to make sure they get the full menu. So what about hospitals? It was in 1998, actually, that NCCIH came into being, the National Center for Complementary and Integrative Health, and this is their 20th anniversary this year. And it was about that time we started getting information on hospitals. And in 1998, 8% of hospitals were offering this. And by 2011, it was up to 42%, which is the last time it was measured. Why were 42% of the hospitals offering this? Because of patient demand. This is what the public wants, that 40% of people who want this. And now the Joint Commission has decided, basically as of this year, all of the hospitals have to promote and provide some forms of integrative and non-pharmacologic approaches to pain. So this is all shifting. You're seeing a shift. That 98-99 was a special year. It was also in that year that 8 centers got together. And these were academic health centers. An academic health center is where like the University of Maryland, that has a school of medicine, also a school of dentistry, the first in the nation, and a school of nursing. So those are academic health centers. And 8 of those around the country said, you know, we're all beginning to look at this integrative medicine. And they formed the consortium of academic consortium for integrative medicine and health, as we call it, the consortium. And these 8 centers, that was in 1999. Flash forward to now, and over 70 members of academic health centers are now part of this consortium, all looking at integrative medicine and health. And you can look for your alma mater on the list. Just in this area, it's University of Maryland, Johns Hopkins has joined, Georgetown, George Washington, and also entire health systems, including MedStar Health and Innova Health for this region, are all now members because they are focusing on integrative medicine and health in their programs. It's a growing focus. And actually, Len just talked about all the other partner organizations that have joined forces. And these are all now going to be in support of the Congressional Caucus for Integrative Health and Wellness. Now, earlier, I wish I could show this in animation. I can't. We need to try to see if we can get that turned on for others. Typically, if you will, when the way our health system has worked, as people are ill and they come into healthcare, and that is what most of healthcare provides. It moves people not into health, but to neutral. It's like if you have the flu and you go and you get some sort of help from your clinician, and then you no longer have the flu. You're not well, but you're not sick. And that's what we've settled for. But integrative health and wellness thinks healthcare really needs to go to optimal health. We should be helping people be resilient, reduced vulnerability to daily stress, give treatments that promote health as opposed to just being okay. Okay is not good enough for us. So the goal of this caucus and our partnership and all the people you'll be hearing from are people who believe in integrative health and wellness, and we want to go the distance for every single person in this nation, from prenatal health all the way through those last choices that people have to make so that we can have optimal health across the entire lifespan.